Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, a call for women to take charge of their health this Breast Cancer Awareness Month. It's a disease that's more common than it should be, and cases are rising. Breast cancer remains the #1 cancer among women and is also the most common cause of death among women in Barbados. Medical coordinator of the breast screening program of the Barbados Cancer Society, Dr. Shirley Jagru, tells Health Today they've been diagnosing more cases.
The last 2 years, we have found, this is only the breast screening clinic, okay? We have found in the last year an average of 1 new case per week. That's only at the breast screening clinic. And then the last 6 months, from January to June, we found between 2 and 3.
She partly attributes the increase to the fact that more women are coming forward for testing, and that's her message this Breast Cancer Awareness Month: early detection saves lives.
Early detection is your best protection. You have the best 5-year survival. Because with early detection, there are more treatment options. And with better treatment options, you will be a better survivor.
Older women are more likely to develop the disease, but this does not rule out younger women who are increasingly being affected.
What we have seen when it comes to the women over 50, breast cancer between the ages of 50 and 65 has always been the highest. But we're finding women over 65 with breast cancer. So when we used to say, stop doing mammograms, stop screening at 70, I'm afraid to say that. You see, I don't say it anymore. I say, just come. I'm not going to insist like I would with between the 50 and 65, but those older than that, because we're seeing women older than that. They're not many, but you do see them. Now, women younger, that's where we seem to have a higher incidence from our observation. Between the ages of 35 and premenopausal, say 48, there is an increase in the number of women found in that.
The cause of breast cancer is still a mystery to experts, but Dr. Jagru says every woman should be aware of the risk factors.
Getting older, of course. The older you get, and then, of course, we are living longer. Yeah. So, therefore, the risk increases because it's what used to be thought of as postmenopausal women disease, because, that was when it happened. The majority cases were over 50. Now we're seeing them younger, but the age makes a difference. And 2, females. It does occur in males, and that's but less than 1%. Then other factors, I just gave you the one with the family history, and then family history of ovarian cancer also, obesity, women who have their first child over the age of 30, those who start their menstruation early, before the age of 10. These are all risk factors that have been done, that they've found from research, okay? And women that menopause late. So in other words, you can see a trend here with hormones, that the longer your menstruation goes on, the higher your risk.
She adds there's no real way to prevent the disease, but she urges women to maintain a healthy weight, eat lots of fruits and vegetables, and perform self-exams from as early as the teen years.
If you do your breast self-examination once a month, after your period, we advise after the period, because if you do it before the period, you get hormonal changes. That will probably be gone after the period, So check it after the period, and we teach women how to check it. And if you find something in the breast that was not there before, then you must insist that you know what it is. And I say to women, the responsibility is yours. Never mind if you feel a lump, you see something, you see puckering. You know, puckering is like if you're stitching something and you pull it too tight, where you would actually see that puckering in part of the breast. If you see things like that, you see vessels, blue vessels or red vessels all going into one area, and that wasn't there, that's something new, then nobody should say to you, but they do, that that's nothing, because they can't know. You insist, look, this was not there before, it is something new, and I've been told that anything new should be investigated.